Every year, about 700 million people are at risk of a schistosomiasis infection because they live in areas where these flatworms are endemic throughout Africa, South America, the Caribbean, and the Eastern Mediterranean. There are three species which cause most human infections, including Schistosoma mansoni, which is depicted in these images. There are about 200 million cases per year, with 20 million people developing severe disease, causing 200,000 deaths annually. This is a fatality rate of about 1 in 1,000 infections. Adult worms migrate to the veins around the intestines, the mesenteric veins, where they can attach using oral suckers and ventral suckers. Male and female worms mate in the intestinal vessels, and one can identify females easily by the paired vitelline glands on either side of the body and the ovary which produces the eggs. After the larvae known as cercaria pass from the skin to the mesenteric veins, where they mature into worms, females can lay 300 eggs a day, which usually travel to the intestinal lumen using the endothelial blood vessels and also Peyer's patches there. These eggs can then pass into feces and continue with the life cycle. The eggs hatch into larval forms known as miracidia, which then infect aquatic snails. Inside the body of the snail, miracidia then mature into the next phase of the life cycle, the cercaria, which are then shed into the water. The swimming cercaria can penetrate human skin, and one is vulnerable to infection if poor hygiene is practiced, if one is exposed to contaminated river water or mud, or exposed to contaminated water. A human who has adult worms parasitizing their intestines then can suffer from anemia and malnutrition. But there is also another way that schistosomiasis causes negative health effects. The eggs can lodge in other regions of the body, such as the liver, which will be depicted in these images here, but also in the intestine, the reproductive system, the urinary system, or even the brain and spinal cord. Here are images of eggs with the miracidia inside, which are triggering the host inflammatory response. And so white blood cells are causing inflammation. The tissue will undergo fibrosis, forming granulomas. These can cause a variety of negative effects depending on the number of these granulomas and the region of the body affected. Some of these effects can be life-threatening or even after recovery can cause permanent tissue damage.